I'm assuming we're live at the moment, so I'll just say hello to everybody. Okay, hello everybody that's watching this. My name's Greg Martin. You're watching Global Health. You might be watching on YouTube. You could be watching on LinkedIn. You could be watching on Twitter. You could be watching on Facebook, wherever you're watching. Welcome. Glad to have you with us. Just one caveat. I've got the worst internet connection imaginable today. I keep dropping off this thing. So if I freeze and disappear, it's not because I hate you guys. I love you. It's just the universe is working against me and technology isn't always what it should be. So big apology. If I disappear, the rest of the guys on the show are just going to carry on without me, and I'll try and log in as soon as I can. So that's my little caveat. Right. As well, because this is a live show, this is streaming live, we're going to give people a couple of seconds to log on and join us. So while we're waiting for them, I'll just sort of say, if you're watching this on YouTube after the live stream, so you're watching this as a video that's sticking on the YouTube channel, remember that you can subscribe to the channel, you can join the channel, and the members that join the channel get access to a whole lot of content that's all about jobs in global health. So the fact that you're watching this means that you may well be the kind of person that wants to join as a member. So there'll be a link in the description below that you can click on, join and remember, fun will be had, come one, come all. This particular episode, we're talking about working at the World Health Organization, which you probably gathered from the title, right? We've got a couple of people on that are either, so Ellen and a colleague of mine, Kayla, is going to join. These are two prospective WHO employees that are interested in that space. Then we've also got myself and Jaleese, and we've both worked at the WHO, and so we're going to have some questions and answers, right? So Ellen and Kale are going to ask us questions about our experience. How do you approach getting a job at the WHO? How do you prepare for an interview? We're going to actually take a current WHO job advert. So it's a job that's being advertised now. It's a live vacancy that you can apply for at the moment. And we're going to put the terms of reference for that job up on the screen and actually dissect it a little bit and talk about what is our approach. How would you tackle this job advert, this terms of reference? Where do you start looking at that sort of thing? So we're going to actually do that sort of together live on the show with you. All right. So that's a little bit of a long preamble. I just want to, Kale is running a little bit late. He's going to join us any second now. And the reason is this is just the end of a working day. It's Friday, 5 o'clock, and there's still things happening. Kale is actually in the same building as me. He's upstairs somewhere, and I know that he's extremely, extremely busy. So he'll log in as soon as he can. But while we wait for him, we'll just introduce ourselves. My name is Greg Martin, medical doctor, YouTube, yada, yada, yada. That's me. Over to Ellen. Ellen, who are you? What are you doing here? What's the lowdown? What's the word on the street?
Yeah, so I'm Ellen Flanagan. I am working in GLG, Growth and Learning Group, as a healthcare client solutions associate. And we basically connect experts with our clients, experts like Elise and Greg here, who know all about the healthcare world. I'm a prospective student in London School of Hygiene and Tropical Medicine next year. So I'll be learning alongside everyone here today and asking all the questions that I need to know for my career in the future.
And you want to work at the WHO one day?
Yes, please.
Okay, very good. And Jaleese, now let me just say, before Jaleese introduces herself, let me just say this. When I first met Jaleese, I was working at the WHO. She had taken some leave or she'd done something, I don't know. And she came back. And she came back, and everybody that I was working with was so overjoyed to see her, and I'd never met her. And I was like, who is this person that everybody loves so much? Like, she must be amazing. Anyway, I got to know her, and actually she is that amazing. She is that likable. I completely understand why everybody loves her so much. So with that introduction, over to you, Jaleese. No pressure.
So yes, I met Greg a long time ago now. And I think it was 2010 actually, when because it was actually, I was on a contract break, and I think you're going to touch on that. At WHO, if you're fixed or short term, it has implications. And at that point, I was short term, so I was on a contract break. So I'm Jaleese McCulloch, and I actually work today at the Medicines Patent Pool in Geneva, and I've been there for a year. So I actually did leave the UN system and decided to go to a foundation at that point, and for other reasons. But I'm delighted to be here today to talk about that, long experience that I had within WHO.
Okay, super duper. Thanks very much, and I'm delighted to have. I really am happy to have you here because you've got a lot of insight in nuts and bolts of having been in the system a lot longer than I was there, and I've even got questions for you, despite the fact that I worked at the WHO for 2 years. If you're watching the show, remember, you can ask questions. I think if people ask questions, if I click on their question, it pops up on the screen. It does indeed. So I've clicked on one there. So I might try and keep an eye out for good questions. It's quite difficult to watch for questions and talk at the same time, but we'll do our very best. And we'll try and pop questions onto the screen and answer them in as much as we can. So please feel free to pop questions in, wherever you're watching, and we'll try and address those questions. Right. I think let's just start talking about working at the WHO in general. And I might start with a question, and I'll throw it to you, Jaleese, and then Ellen, you may have questions you can throw at either of us, and then when Kale gets in, he can get involved with questions as well. But Jaleese, what made you want to work at the WHO? What was the appeal? Did you stumble into it? Did you always want to work there? How did you land up working at the WHO?
I think one thing's for sure, and I'm 50 now. When you start out young, it's not really clear what your life path is going to take you and where it's going to take you. And one thing in life is to be adaptable and change and what have you. I actually did my first degree in communication studies, and I actually worked in advertising for many years, actually flogging synthetic trousers. And it, yes, I did. But it was quite a stressful environment, and one thing and another. And then I had one baby, and I lived in a small house in Yorkshire. And then I had another baby coming, and the house in Yorkshire was too small, much too small for us. And we actually had this house that I'm in right now, just on the outskirts of Geneva, because actually WHO for us is a bit of a family thing, because my husband works there and has been there for 20 years, and his father worked there. So he was working there. He started there in the 50s, and when, was out in Ghana and all over the place. So we had this house, and we came back here, and within 6 weeks actually of being here, Michael got the job at WHO, and we had a bigger house, we had another baby. And I was starting to get then into sort of doing consultancy. So I actually started off as a consultant for WHO. I had a community background. Exactly. So I was doing
something we should talk about as an interesting way into the system is perhaps to consider doing consulting work.
So it was actually Michelle Sidibe's wife who was my first person who gave me my first contract with WHO. And at that point, and I think it was 2001-ish, I was doing fact sheets on HIV. And you imagine in 2001, what the data was for HIV at that point. I was like blown over by all these figures of people dying, and it was fascinating. And I suddenly realized, my communication background was really useful in trying to put across messages for WHO and others. So I started doing that. I had other clients as well, UNDP and other UN organizations. And when I got to about 36, I decided that I loved doing my communication work, but I actually needed to have a master's degree, which I didn't have. And so at 36, I signed up for the London School of Hygiene and Tropical Medicines and signed up for the Masters in Public Health. So at that point, I was actually working at GAIN, so Global Alliance for Improved Nutrition. I had 3 young children, because another one came as well. And it happens. And then this master's, and actually Michael did it at the same time. So 4 years, and I was just telling Ellen before this started, it took me 4 years and a lot of toil and no painting at all to complete. And in that time, I actually went from GAIN to UNDP, and then I got this job at Unitate, which was hosted by the World Health Organization. And I did go in through the communication route, but I quickly changed over to the strategy route. And that's how I got into WHO.
Okay, now I'm going to ask you a quick side question because it came up in what you were just saying. Your art. Actually, I'm not even going to ask you a question. I'm going to tell people, because this is just a slight aside. And this is an interesting thing, because this to me illustrates how getting involved with global health, you can get involved with global health from any angle you want. literally any angle. So Jaleese is an amazing artist, and I am the proud owner of a couple of Jaleese originals, and I have them up at my house. And she does amazing paintings. And these paintings are often about humanitarian or health issues in developing countries. She sells these paintings, and then the revenue from the paintings goes to help pay for education of HIV orphans. Is that right, Jaleese? Have I got it? Have I sold you correctly?
Not all orphans, but they're all born HIV positive. Some of them
they're all born HIV positive. Okay. Now,
so in my work, and I can see some of the questions coming through, like, do you need to live in Geneva? Do you? Well, nowadays.
Yeah, I was trying to pop the questions up as they were coming.
Yeah.
So that's a nice one. That's a nice one. Look at this. What was the best part of working for the WHO? Great question, Anna.
Travel. Sorry to say. No, I was really fortunate that, when I started at WHO, I actually had never been to Africa. I'd been very far, really. Remember I was doing my marketing before that, and I hadn't been very far. So very quickly, I was going to places, meeting people from all over the world. And I feel I'm actually really, really privileged because I've been able to see Africa through its health system. I've gone to all these different clinics. It's mainly been HIV, TB, and malaria. But I've gone to all these wonderful places and met the most amazing people. And as Greg said, I was, one of the people I met back in 2011 was a young girl living with HIV. She was 14 at the time. She was with her mother at one of these civil society engagement meetings about what could we do better in Kenya in HIV. And she wasn't in school. And it just dawned on me that, if she wasn't in school, what future do you have and what life choices can you make if you don't actually have an education? And so that's when I started. And at the same time, I'd finished my master's, which took up all my time. So now I had time to paint. So I got painting again. And I did my first exhibition for World AIDS Day, I think it was 2012 at ILO, in that beautiful long hall of ILO. If you know ILO, it's got a gorgeous hall. And people asked if they could buy them. And I thought, oh, okay, then I'll sell them. And then the money, I would put the girls in school. So I have that on the side going on.
If somebody wants to look at and buy one of your paintings to contribute towards education of HIV positive children, where would they go? Quick advert.
Oh, it's Jaleese.org. My name, GELISE.org.
Okay, so if you're watching this and you want to make a contribution to education of HIV positive children, go to Jaleese.org, buy a painting. The paintings are amazing. I honestly think she's one of the best artists that I've ever seen. And that is genuinely what I think. I know that sounds a little bit contrived, but it's not. All right, more questions. Should we Ellen, have you been looking at the questions? Are there any that you want to just highlight that might be worth us addressing?
Yeah, there's a few great questions here. I think what is the best way to start off in the WHO? We're going to probably get into that a little bit. But a good question here that I don't think we've discussed yet is, do the WHO offer internships? And yeah, so what do you think about that one?
The WHO offers internships. The internships are a little bit competitive. So many years ago, in sort of like 2001, I did an internship at the WHO. And I'll say this, and I don't know if it's changed, but the internships at the WHO are unpaid, which is not the case with a lot of...
It's changed.
It's changed.
It's changed.
Great news.
That's good news, because that used to be a big deal. That was a serious problem, because what it meant was, in order to do an internship at the WHO, you kind of needed to have access to money, because Geneva is an expensive city. I mean, it's really expensive. And to stay there for 3 months with no income, you need to have a friend that you can stay with. It would be impossible. So if you come from a low-income country and you don't have resources, it would be not possible. And the point of the internships is to develop these relationships with people. They go back home, and these connections with low and middle income countries should be there. So it is now a paid internship. Hooray!
But there's something. It's quite. It's quite a certain amount. I wouldn't want to be quoted exactly, but it's like 2,500 Swiss francs a month, which would certainly help young people. And you fully agree. It allows then. I had an intern with us a few years ago, with Winnie, and she actually saved from her first degree and the subsidy that she got for her first degree in Norway, and she was Ugandan, to pay for being in Geneva, and she was doing cleaning jobs on the side, and it's just not fair. It's just not fair.
No, it's crazy talk. Yeah. So now there's paid internships, and I did an internship at the WHO. And this was even, I think I hadn't done an MPH even at that point. And this was really what inspired me to get into public health. Because in that internship, I remember one of my jobs was to look at globally what was happening with respect to the illegal purchase of kidneys. So who was buying and selling kidneys? And I just found it fascinating. I was like, this is like completely different to anything I've ever done before. And I really got excited about public health and the difference you could make. And that was kind of pretty much the beginning of my journey in public health in a lot of ways. The question you just asked a few seconds ago, Ellen, was like, I think you kind of alluded to sort of getting into the WHO, and Janice and myself both got into the WHO initially as consultants doing consulting work, and that is unbelievably common. So if like that's advice I often give to people is applying for jobs cold is sometimes difficult. A couple of reasons. Firstly, there may be an incumbent already. Now, while strictly speaking, in an ideal world, it's a fair competition and the incumbent doesn't have any advantage over any other applicant. But in reality, the person that's already at the desk, already doing the job, already knows all the people and the hiring managers and the people that are going to do the interview. It's human nature that person would be at some kind of an advantage. Added to that, for any one job that's advertised, there's many, many hundreds of applicants. So applying cold, I'm not saying don't do that, but you know what I mean? It can be difficult. Doing consulting work, it's your foot in the door, you get to know the people. You also get a better sense of which jobs you would be more suited to, right? Because you've been really in the mix, really at the coalface. So,
and how do you get your foot in the door even to get the consulting work in the first place?
That's an interesting question.
There are many sites out there that, UN Jobs is one of them. There's another communication initiative. There's different places. UNDP often has things. It's not an easy one, but there are different, you have to follow, maybe, use your LinkedIn contacts to maybe befriend a few people from WHO, follow them, because they tend to put things out. That's what I was going to say. For the bigger contracts, they're usually out there somewhere, right? And even the WHO website, there's a little click you can link on for consulting work, and they are usually, tell me if I'm wrong, Jaleese, but those advertised contracts are usually $25,000 and above, because if it's more than $25,000, they have to advertise it. They do.
And then it's competitive, and if it's competitive, often there's like kind of consulting companies competing for those jobs. The smaller contracts, which are often just at the discretion of a department that's got a budget, so it doesn't necessarily have to be advertised. They may just be able to hire someone at a whim, given there's a need and you could fill that need. That's often an easier way in, but that is what you need to do. Is you need to expand your network. And Jaleese alluded to LinkedIn. LinkedIn's a great way to do that, make contact with people. Advice I give to people, and this is not just for the WHO, I think this is for your career in general. If there's somebody upstream from you and you think this might be a useful contact, this person might be able to help you get your foot in the door, or it might be a good mentor or something, reach out to that person. And this is what I suggest you do. You send them a short email. Don't make it long, because if it's long, they're not going to read it, right? They don't know who you are. So that some strange person sends them an email 2 pages long. No one's got the time for that. Short email, right? They're going to read that. Include in the email a question, so it gives them some reason to respond. Make it a thoughtful question. So say, this is what I did once. I wanted to meet Derek Yak, who at the time was the executive director for non-communicable disease at the WHO. I sent him a short question, and I said, I read a paper of yours, which I found interesting, but I have a question. And I just put in a little one-liner question. And the point of the email wasn't the question. I didn't really care about that, but I wanted to get a reply. And then off the back of that reply, I said, if you've got the time, I'd love to meet with you and get some advice. And he said, yes, that's fine. And we met. And actually, off the back of that conversation, Derek and myself started the journal Globalization and Health. So, you know what I mean? Getting a foot in the door, a short email, a little question, be polite. And that's a great way to network. But I mean, Jaleese is absolutely right. Expanding your professional network is often the way to get that consulting work. And the consulting work is often a good foot in the door, for more substantial, like a short-term contract that could turn into something a little bit longer.
I think there's a lot of interest in this, in the consulting kind of avenue, because I think this isn't something that's discussed very often. Could you talk a little bit about what these contracts or consulting work actually looks like, if they're kind of short-term, long-term, and what kind of projects you might be working on?
Okay, I've got a couple of ideas, but Jaleese, do you want to jump in first?
Yeah, so I mean, in my experience, because I can talk to that, as I mentioned, the first consultancy I did was doing fact sheets on HIV. It was a communication role. There are, and people have asked, do you need to be a medical doctor? No, you don't. There's hundreds of jobs out in WHO which don't require a doctor for. There's all sorts of things. And
there's actually very few doctors.
Exactly, and sometimes you can be, there can be a doctor of poetry and still get so no, being a doctor isn't an essential. WHO has a whole host of needs. You've got the scientific, technical people who possibly are the doctors, but then there's the whole management side of it. There's the whole communication side of it. There's plenty of publications, writers, editors, finance people. It's a big machine, and so
monitoring and evaluation.
Project management, or program management. There's plenty of things to do within an organization. From a consultancy front, it will be more specific, and you can start with something short, as Greg said, because then you don't need much money, and so you get your foot in the door. You do 3 weeks work on an evaluation of something, or helping out on something else, and or it's data. Sometimes it's even just creating a database or just finding input, because a lot of the time these people haven't got the time to go out and dig for this information, and so they look to consultants to help. You can, and that's what happened to me at UNDP. I had another consultancy, and that was UNDP, end up with a much longer consultancy, and that was basically a year consultancy. Being a consultant is fine. It gives you that flexibility. You don't, obviously, you're on your own. You have to declare your own taxes. You don't have paid holidays. You have no staff benefits. And it has to be said, the UN don't really pay their consultants that well. Once you've paid your tax, because you do as a consultant pay tax, once you've done all of that, the little, it can get, it can be quite small. But you can do a consultancy job from anywhere in the world.
That's a big plus.
That is a big plus. That's a big plus. One of the things that I just thought I'd say is, because part of the question that came across was like, what kind of consulting work comes up? And when I've spoken to people about, I've made the suggestion that they do consulting work, they often feel as if, I wouldn't really be qualified. They kind of have in their minds that they need to be kind of some kind of McKinsey or Bain and Company style consultant that would sweep in and develop a global strategy for the WHO. That's not what the consulting work is for the most part. Most of the consulting work is there's a unit that have got a job and they need a little extra horsepower. They need some hands on deck. Maybe somebody has gone on maternity leave or left, and they suddenly need that. They're needing a pair of hands mostly. There's a component of the work that might be a bit behind, and they need a bit of help with something. And actually says often that'll be they need someone to do a literature review and collate the evidence on a particular thing. You don't need to be a rocket scientist to do that. You need to know how to do a PubMed search and be intelligent. And that's not exciting work. You know what I mean? I know a literature review. I mean, no one's going to kind of jump up and down and get out of bed about that. But it's a foot in the door, right? You're in the room. You're making those contacts. You're developing those relationships. So I would just, if I was trying to get into that, get your foot in the door, take whatever you can, even if it's not exciting work, because often that consulting work won't be exciting. I mean, the fact that they're trying to farm it out means it's not that much fun, right? Just do it themselves. And sometimes it's a project that's behind timelines, and they're needing somebody to, come in and be an extra pair of hands on that. But so the consulting work, the lesson, I think the summary is a big part of the consulting work is about relationships. Expand your professional network and let people know that you're available to do consulting work. Okay, and you might even just say, look, I'm available to do consulting work. Here's my CV. Could you, would you mind forwarding it on to anybody that you think might be looking for some help? And you'd be surprised, the WHO people are often looking for help. Like there's often, what the funny thing is about the WHO and consulting work? I remember being outside the WHO, looking in, thinking, how do you get consulting work? Like it just looks like a black box. Then, exactly. When I was on the other side, when you're in the WHO, you sort of think, well, how do we find a good consultant? Where are they?
If only there was someone to connect the two.
You create like a matchmaking, like an online dating.
Yeah, exactly. And what you actually do is you go, I remember so-and-so sent me a CV.
Exactly.
So don't knock sending your CV out there, because it does stay with someone and they go, oh, yeah, I remember.
Send your CV. And on the CV front, boil it down to one page. This is my other people might differ on this, but I kind of think just boil it down to a page. If it's like 10 pages long, nobody's reading it. If it's one page, they'll read the whole thing.
That's always been the advice that I've gotten recently as well, just always one page. And have you both been on the receiving end of having to procure consultants a lot when you were at the WHO? And what kind of things did you look for? What profile of person, or masters, education, that kind of thing?
You get all sorts. You get the individual consultant, then you get the consulting groups as well, and your RFP. What do you look for? And I noticed a few questions. Do you need a master's and that sort of thing? Having a master's helps. Hence why I did it at 36, because I knew that without my master's, I could probably only ever expect to get to a certain level. I know, but they do say that you can have experience and it counts and it's equivalent. So if you've been in WHO 10 years, your experience of 10 years could be considered for that higher position. But a master's does help. And those qualifications are important to have.
Yeah, and when you start looking at the terms of reference of jobs that are advertised, quite often you'll see that sort of, the basic requirement is a master's level degree. There may be some wiggle room around that, but something I was going to say is, look, when we start looking at the job that we've got lined up that we're going to talk about today, what you need to realize is that when they lay out the minimum requirements for applying for the job, when you send in your application is not going to land on the desk of the hiring manager. So don't think to yourself, well, look, I don't quite meet the criteria, but I'm going to write this stellar cover letter and explain how it is that I really, really, really am the right person, and I really, really, really want the job. And I'm sure that when they see how much I want it and what a lovely person I am, they'll ignore the fact that I don't quite meet the criteria, and they'll definitely give me the job. And that's never, ever going to happen, ever. Like, not going to happen. Because the reason is this. Firstly, your application isn't going to the hiring manager. Your application is going to the human resource department, who are getting hundreds and hundreds of applications. If I'm working at the HR department of the WHO, my objective for the day is to finish the day at 5 o'clock and not stay until 2 in the morning. And the way I do that is I look at this big pile of applicants, and anybody that doesn't meet the minimum criteria gets crossed off the list, end of discussion. And that's the reality. So this is why I was saying, when we look at a job terms of reference, the first thing you look at, you go straight to the criteria, the eligibility criteria. Look at that. Decide if you tick the boxes. If you don't read the rest of the application. You're wasting your time. Rather look for a different kind of job. And it's not that difficult, because the job we're going to look at this morning or this evening is what we call a P4 job. And we can talk about the sort of hierarchy at the WHO. So you look at a P4 job application and you see, oh, this job requires of me that I've got 7 years experience, but I don't have 7 years. Well, the solution to that is simple. Go and find a P3 job and look at what that's asking for. And that's going to say, you need 5 years of experience. And you'll be like, oh, okay, I meet that criteria. Let me maybe look at this job. You understand what I'm saying? If you don't meet the 7 years criteria, if you're 6.5 years, you're off the map. You know what I mean? So like, I know that sounds harsh, but that is the reality when it comes to
relevant experience. It has to be, and it has to be demonstrated within your application. So you could say yes, and then actually when they go and look inside, they think, well, actually, I can't see the 7 relevant work experience.
They will look at your CV, and you need to be able to join up. When they say relevant experience, you need to say you've been working in that particular role. Not the exact role, but in that area. Now, that's a question that, I mean, I don't know the answer to this, but like sometimes they say sort of you need 7 years of relevant experience. And the job we're going to look at today is an example of that. They say that's the exact phrase they use. They want 7 years of relevant experience. And it's not clear to me whether they definitely want you to have worked in antimicrobial resistance for 7 years, or this particular job is a job of a biostatistician if they want to know that you've worked as a biostatistician in research methods for at least 7 years that overlaps with antimicrobial resistance. I'm not sure that's entirely clear to me and the terms of reference aren't very specific on that. But my guess is they probably want you to be a biostatistician that's been working in antimicrobial resistance for 7 years. I'm not like, I don't really know the answer to that. Any other questions that are popping up that we need, the burning questions? Ellen, anything that, any questions from you? You're a prospective WHO employee.
Yeah, well, I think the question, and I've seen it come up a few times, is what did you both love most about working in the WHO?
Okay, do you want to go first?
It's a tough one.
Lisa's answers, I think she loved most was meeting me and
the colleagues are
and
incredible.
I mean, that was definitely.
Know that right now we might, and I know I've seen Kazim's comments there, we might appear quite white. We don't work that way in WHO. You work with many, many, many different people from different backgrounds from all over the world.
That's true.
And that, I think, is, you say the hiring managers are Western. Well, actually, they're not at WHO. In many of the departments, they are from all over the place. And so, in fact, they want diversity. Diversity is something, if we all think the same, then we're all going to, we're not going to have any new ideas around the table. So making sure that gender balance, making sure there's diversity, making sure there's voices from north to south is important to WHO. Now, remember, there are regional offices. So obviously in the European office in Copenhagen, well, obviously there's lots and lots of Europeans. When you go to Afro, there's lots and lots of Africans. It makes sense. Same with India, same with, Wipro and all these different regionals. Headquarters, it tries certainly in the P level, and because I noticed, PGs also, general staff, professional staff. In the professional staff, that's where the diversity is. Also note that there are quotas. WHO has quotas on nationalities depending on their subsidies. So they will have a certain amount of UK people can work for them, a certain amount of US, a certain amount of Kenyans, a certain amount of from Barbados. And you might think, oh, I come from a really remote place like Uganda. You'll be surprised how many Ugandans are at WHO. So nationality, and they have them A, B, and C, they classify them. That's another defining criteria, is do we need people from those regions or not in the selection process?
Mm-hmm. Yeah. I mean, it is an interesting thing. And I mean, if you think about it, the WHO are very often trying to solve problems and provide assistance and support to countries in the South. And, by South, we mean, low and middle income countries, because Australia's in the South and they hardly fit the bill. So having that sort of diversity of thinking, even at the headquarters level, is quite important. And you do see it, and I see in the comments there are people that disagree. We're not here to debate it, but obviously, it's not a perfect world. There may be circumstances and there may be components of any organization where people feel that it's not represented in the way that they would like. But my experience, and I'm sure your experience, Jalise, of the WHO was that it was an organization that was very, very much concerned with the global community and was embracing of diversity in as much as it could. And just to answer the question that you asked a little bit earlier, Ellen, what it is that I loved about the WHO the most? I mean, there were two things. The first was a real sense that you were working in a space that was making a big difference. And we really felt that. I mean, I know that sounds a little bit contrived and, but it is a environment in which the reality of that just feels very tangible. And then the second was I just found I love being surrounded by what I consider to be absolutely amazing people. And I've made friends that definitely friends for life without question, people that inspired me, people that gave me advice and direction, and that I still consider to be mentors to this day. So that was, for me, professionally, that was an absolutely lovely experience. And I won't lie, I enjoyed Geneva. It's a beautiful city. I mean, it's absolutely lovely. And 2 years, I never felt that Geneva would be home. And I think a lot of people have that feeling. Geneva doesn't, for a lot of people, feel like home because it's quite transient. People come and they go. I tried to learn French, failed miserably. Like,
yes,
literally. I don't know. That part of my brain just has left the building. So
That's actually, sorry to interrupt your how much you love Geneva, but one of the job descriptions had French in the description. Is it a requirement to work in WHO to have even another language?
It can be.
So
Definitely.
most jobs,
there's official, the UN official languages. And obviously French is one of them, Spanish sometimes too. So I have found, for me, having French has been exceedingly useful in my career. Sorry, Greg, but it has.
No. I remember being in conversation, like I'd be in meetings, because the part of the WHO that we both worked in was UNITAID, which was very French. I mean, it was like extreme. There was a lot of French people, and conversations would often be in French, and I'd be kind of putting my hand up and saying, "Hey, somebody needs to translate this into English." But the working language at the headquarters is mostly English, but they'll often put in the job adverts, and in actual fact, it is the case in the job advert we're going to look at today. They'll often say, it'll be an advantage if you can speak French, and that is, or another UN language. And depending on where it is in the world that you want to work, the language does become an issue. So that's an interesting question. Yeah. I'm confined to English or Zulu. Never going to happen.
Many people don't speak French, so
that's true. That's true. If I could make it, anybody can. Okay. If there aren't other questions, we can jump right into the job advert. But I'm not in a hurry. Any other questions, Ellen?
Before we go to the advert, could you describe, you touched on it, but the difference between P and G staff?
Oh,
professional and general?
Please, do you want to jump in?
Yes, I mean, you have general staff and you have professional staff. General staff tend to be more administrative support for WHO. And so they tend to be recruited locally. And they are, the grading system, it goes from sort of a G, turns about to G2 and then up to G6, and then you progress in that. A G6 is a very skilled person. Do not knock it. They are very skilled people who can do a lot of really good work. Then you arrive in the professional category, which is the P1s to P6. Then after P6, you arrive in the director, which is like D1 to D2. And then after that, you get into the ADG, so the Assistant Director Generals, of which Tedros has about, how many? 10? I don't know, don't quote me on numbers. And then you start, there are not many P1s, they're the most junior, and P2s, so that's the smallest category. You get a big body around the P3, P4s, which is the 5 years to 7 years experience. And then the P5 is 10 years, and P6, possibly more again. Somebody asked about salary scales. I think they're on every single job description. You get what the salary is, and then there's the post adjustment. So your salary will be a certain amount. And then depending on where you are positioned, so if you're in Geneva, or if you're in New York, if you're in Delhi, or in Brazzaville, the percentage, and it gives that in the job description, the percent more. So so it will, you times that amount by that percentage would give you the base salary for that. So it's very transparent.
And we'll have a look at the remuneration in the job that we're looking at today. I mean, the short answer is, like, the WHO for it does pay well. I mean, it's a healthy paycheck. I think, part of that is they're wanting to recruit extremely high quality people and make it an attractive career opportunity for people. And in my opinion, it is an extremely well paid role. I mean, when I left the WHO and came and worked and lived in Ireland as a doctor, I worked for the Chai in between, but to compare what I earned at the WHO to what I earned in Geneva, in Dublin as a doctor, I earn substantially less now than I did, and in a senior position in Dublin than I did in a relatively junior position at the WHO. But there's Geneva is an expensive city, and there's all sorts of reasoning and thinking behind the paychecks that they are there. But we'll have a look at that. We'll have a look at that today. We'll have a look at the paychecks. Okay. Any other questions before we jump into the job itself?
I like that question there that's just popped up.
Oh yeah,
I was going to ask that question. It's a nice one.
Okay, does the WHO recruiting process make it more difficult for people coming from the private?
No, it's what do you think you would have done differently when you started out in a public health career? What do you know now you wish you knew then?
Okay, we'll come back to this. Hang on. Is this what? That's the question you're asking?
Yes.
Yeah.
Okay, we'll come back to, the short answer to the person asking about the private sector is no, you can absolutely transition from the private sector into the WHO. And I've seen it many, many times. And in actual fact, people moving from the private sector bring fantastic skills, fantastic qualities, highly recommended. And as I said, WHO does pay well, so it should be an attractive career move. So that's the answer to that question. But let's get into this question. What do you think you would have done differently when starting out in a public health career? What do you know now that you wish you knew then? Okay. Jaleese, what do you think?
I think what could have helped is I mean, it's really important to have country experience as such. And if you're coming from a country, it's great to have done some of work in your own country first. And in person like myself would obviously to go somewhere and work there, South Africa or wherever, anywhere, just to get that experience, because WHO definitely are looking for diversity and experience. So if, for example, like my really good friend, she wanted desperately to be at WHO, but she went off actually to work to UNICEF in Lesotho. She's Ugandan. And she went to Lesotho and she built up her experience at UNICEF and then came back. I mean, she's creating her path is with UNICEF, but don't underestimate the importance of country work and also working for others. You mentioned Chai. There's plenty of NGOs out there that you can crack your teeth on for a bit, show that that you're willing to go down and do things and maybe not earn so much for a while. But that experience is invaluable. And I think I would have, instead of doing synthetic trousers when I was 22, I would have, and if I knew that I was going to go into public health, I would have think that, going off and doing something, anything would have been worthwhile.
So something that I still haven't figured out the answer to, but I'll just throw it out there because this is something that I think in public health you need to grapple with throughout your career. And that is the tension between developing subject matter expertise on a particular disease area or particular programmatic area and general transferable skills. And there's obviously most people get a combination of the two. And some people land up kind of erring to the one side or the other. And it's an interesting thing. I started out working in HIV. I saw people that became real HIV kind of specialists in a sense, like they really hunkered down in that subject matter area. And they progressed very quickly because that sort of deep technical knowledge is tremendously useful if you hunker down in that space. But it does mean that that's the space you're stuck in, which is fine. Some people, they just love that subject matter. They're passionate about it. That's what they want to do. And absolutely, there's nothing wrong with that. Kale has arrived. Yay, Kale. I know you've been busy, Kale, so you are most welcome. Kale, can you hear me? I don't know if you can hear me. I don't even know if that he knows that he's on. Kale, you're with us.
Yes, hi. Sorry, technical issues, many technical issues.
Technical issues, not a problem at all. Thanks for joining us, Kale. As I always introduce Kale, he's one of the most lovely guys you'll ever meet. High five, thanks for joining us, Kale. So
thanks, Greg,
I was just talking about the fact that for me, there's always been a tension between becoming a deep technical subject matter expert in a particular programmatic area or developing broad transferable skills. So, like, for example, I did an MBA at one point, and I've actually found that tremendously useful because it's a skill set that you can apply in almost any setting, and it makes you very sort of diverse. Okay, doing an MBA is a lot of additional hard work, and I don't recommend it unless you're really interested in that sort of thing. But so, the question was like, what do you wish you knew then that you know now? Well, I don't really know the answer to that now, but it's an ongoing question, and I think people need to grapple with it. And the more you can get your head around the problem early and kind of think about what it is that you want to do, the better. Okay, any other questions? Kale, you haven't had a chance to ask questions. Do you? I know you've been trying to get online and finish some work, but anything from your side?
Look, I think I missed a whole lot of questions there. So I know I heard and saw some really great ones coming through. I'm pretty sure you probably answered a whole lot of them. So I don't want to waste time by repeating any questions. So
okay, not a problem. Look, why don't we jump into the job itself, right? Because we've been talking about the fact that we're going to be looking at a job, and on the screen now you should see the terms of reference of a job that's been advertised at the WHO right now. Just so that you know, if you go to the WHO.int, that's the WHO webpage, at the top of the web page, there's an About Us section, and you click on that and you look for jobs, and there's nothing there. And you think, okay, the WHO jobs are hidden from me. They don't want me, they hate me, and I'm going to go home. Don't. Scroll right down to the very bottom of the page. Bottom. Scroll down. And again, there's a little heading that says About WHO. And under that heading, there's a little hyperlink called Employment. You click on that. It takes you to a page where you can choose to either consulting work, internal candidates, or external candidates. Click on external candidates. It takes you to a very easy to use, user-friendly search engine where you can find jobs. And I'll do another video on that some other time. But anyway, on that, here we've got a job that's live. This is currently being advertised at the WHO. You can see the end date is February the 15th, 2021. And we're not going to go into this in great detail. I've made a few comments. This is in the antimicrobial resistance program. Oh, Kale, this is something you're interested in. Antimicrobial resistance.
Yes.
Before we look at the job interview, tell us what a big deal that is.
It's huge. So it was only. I can't even overstate how. Yeah, because the more I started looking into it, the more shocked I was at how big it is. So currently, it's a progressive kind of thing. Currently, we're kind of seem to be at the tipping point for it. So right now, just for drug-resistant tuberculosis alone, we kind of have 500,000 people being diagnosed every year, most of which go untreated, and kind of 250,000 deaths per year. We've got an extra nearly 1 million people dying from resistant bacteria, but by 2050, it's predicted that this will be up to 10 million deaths per year from antimicrobial resistance. And to put it in context, I guess we've had 2 million COVID deaths in the last year. So there's 5 times that every year. And it is predicted to cost 3.5% of the global GDP by 2050. So massive.
Substantial problem. And something we need to take seriously. So the WHO have got a program that addresses antimicrobial resistance. I'm not going to read this entire job description for you. That'll take a long time. I'm just going to highlight a couple of things just in terms of the program's objectives to mitigate resistant infections and overall impact of antimicrobial resistance globally. As I said, when you start looking at these job applications, don't read all of this hoopla, right? Go down, ignore the duties. Here we go. Required qualifications. This is where you start. And the reason is you want to figure out, am I eligible for this job? If you're not, move on. Like start looking at something else, because it'll take you like an hour to get to this point in the application, and then you discover that you're not eligible and you've wasted your time. So go here first, look at these criteria. Here we've got, now in this particular case, they're obviously looking for a biostatistician, a first degree in biostats, and they want an advanced university degree in biostatistics, epidemiology, or a related field. So they want someone who's done biostats as an undergrad, and then either more biostats or epidemiology or something related. So there's a little bit of space there. And then they say with a strong background in quantitative and qualitative methods. And that's kind of an unusual combination. Like most people are strong, especially if you're looking for a biostatistician, right? That person is by virtue of their educational background going to have a strong quantitative background. They're wanting someone that's got some qualitative skills as well. So that's interesting. And that's the sort of thing that you need to take note of, right? And in your application, if you don't tick that box, you're off the map. So that's why you've got to read these things carefully up front. Desirable, a PhD of the other. So desirable, you don't have to have, and that's okay. Again, with experience, they say here a minimum of 7 years experience in the field related to this position. Now, I'm guessing that they want you to have experience in antimicrobial resistance, even though, you know, the job is very much kind of quantitative experience, biostats. I think, and Jaleese, what do you think when they say 7 years of experience in the field related to this position? I'm guessing they're looking for people that have got antimicrobial resistance experience. You agree with that?
Yeah, but you can sometimes, and I don't know if you're going to get there, Greg, before you even go, once you run through all this, you apply to the job, you go through all the steps, even if you've not done it, and you go to look for those qualifying questions, because before you submit your application, there's a section which will list out questions and you have to yes, no them, yes, no them, yes, no them. It's always good to know what those questions are up front instead of going through your whole application process and then arriving on that screen and go, oh, wait a minute, and you're tired and you're fed up and you've spent 15 hours doing this application. Actually, they've given me a bit more detail here. Maybe I should go back, and you're too tired for that. If you know those qualifying questions up front, it's really helpful, because even though it's written out here, it's written out even better in the qualifying questions that you yes, no to before clicking sign and send.
That's great advice. So on the web page where this job is advertised, there is an apply now button that you click on, and it takes you to the actual online application form. And that's what Jaleese is talking about. And perhaps in another episode, we'll do that. We'll actually go into one of these things and go through the application step by step. Good idea. Good advice.
There's actually a good question there as well.
Okay, hit us with a good question.
So Anna is asking, does number of years of required experience usually count to education? Can you kind of put that in if you say dissertation with this so-and-so?
No. They want work experience, unfortunately.
And remember,
it's a good question. It's a good question.
It's a very good question, because the WHO is looking for a certain amount of experience because they're a technical agency and they need to have people with sort of, technical expertise. It doesn't mean that all the jobs are that, but when you're getting into these P4 level jobs, they are looking for sort of sound grounding that you're bringing to the organization.
Here's another question related to education needs. Do they accept a PGD in public health? I'm not sure what a PGDG is. Does anybody else know? Maybe it's supposed to be a PhD?
Yeah.
I'm not sure. If that's meant to be a PhD, then the answer would be yes.
How do you know that a targeted person have not already been selected? Because this is something that happens often. And Michelle, I fully agree with you on that. This job, however, is a temporary job. Temporary as opposed to fixed term. Temporary have more likelihood of not having an incumbent, and Greg spoke to that a moment ago. So if it's temporary, there's a good chance they haven't got somebody in mind yet. And temporary is a contract that can be 1 year or 2 years. And after that time, you have to go on a contract rate, which is where I was when Greg met me. And you have to actually separate from the organization for 1 month, and then you can actually come back and continue your temporary. And there are a lot of people at WHO who are on these temporary contracts. When it gets to fixed term, which is what obviously all temporaries are after, you've been there 2 years, 4 years, 8 years in a short term, temporary position, short year, 1 year. You want to obviously become fixed because that way, life is more secure. You can negotiate with your manager that maybe it's about time they advertised your job fixed, and they've got the budget and they've got visibility and they know that they can do it. They'll advertise that job for you to apply to. It will be an open competition. They cannot guarantee you will get it. Am I alone?
No, I just made you bigger.
Oh.
I'm new to this platform, man. Okay, hang on.
It doesn't mean you will get it, but that's when you have what they call incumbents. So that's when you are the person is sort of you might be competing against somebody who's in the job. You might not. It might be completely open, and that happens as well. But there's a good chance of that, and that's when I think. And I went on one of these career WHO training, because they train staff as well. And that's where they sort of advise you. And it goes back to Greg's thing, is to actually try and look at that department, reach out to somebody in that department, just put out feelers. Is this, I'm interested in this job, what do you think? Or some question that, like Greg did, that said, tell me more about something random, just to find out if it really is an open position or not.
Yeah, that's really good advice. And I'd recommend you do that, because the WHO advertises a lot of jobs, and doing an application properly takes a lot of time. So you really want to choose the right application to pour yourself into. And so that's really good advice. Okay, so we're looking at this particular job, documented experience of development of a research project. So they want to know that so the more you look at this particular job, the more you realize that they're looking for someone that can do research, that can collect data, that can analyze data, that can report on data and make some sense out of it. And so that's really what this job is looking for. Demonstrated exposure at the international level. Now, you might sort of think, well, does that necessarily have to be in the space of antimicrobial resistance? And the answer to that comes in the next section, because this first bit is essential. So you have to have these things. If any of these criteria aren't met, you're not in the game. Desirable, it's less essential, but these are competitive jobs, so you want to have these desirable boxes ticked as well. And here, under desirable, they say desirable international level experience, international level related to antimicrobial resistance. So that's going to be to your advantage. I'm not going to go through this line by line, but they'd like experience in the area of control of infectious disease, survey software. They definitely look surveillance of infectious disease. So they're wanting somebody that's got experience in the space of infectious disease, certainly experience in terms of antimicrobial resistance, and somebody that's got strong quantitative and qualitative research method skills. So that's what this job is looking for, at least 7 years of experience. So you can apply for this job with a master's level. You don't have to have a PhD, and 7 years experience. So it's conceivable that a person even in their late 20s could be eligible for this job. It's a P4 position. It pays quite well, so it'll be a competitive job. So in actual fact, in reality, you probably, the 7 years would be the absolute minimum to be eligible, and you'd be up against people that have got more than that, I imagine, for this particular role. So just keep that in mind when you're looking at these sorts of jobs. Skills, I'm not going to go through this in detail, but in terms of these skills, it's really as a repeat of what we've just looked at in terms of qualifications and experience. And then there's these WHO competencies. These are all things, if you don't tick these boxes, you probably shouldn't be really applying for this job. Teamwork, respecting and promoting individuals and cultural differences, communications. Anyway, I'm not going to go through those. Those are things you should be able to tick off quite easily if you're the right kind of person, and you should be if you're looking at this kind of job. Okay, let's go back a little bit. Duties. I mean, we've got general duties. Looking at these general duties, these are things that it looks like anybody in this department would really need to be able to get involved with, but they're not duties that are specific to this particular role, because the next section, it says specific duties. And Ellen, I know you had a look at these. Did you have any thoughts about what was written?
Yeah, it'd be interesting to see what you guys think about these ones, because when I saw specific duties, the first point there, the first paragraph, it talks about developing methods, protocols, tools to assess and analyze the magnitude. So that sounds to me like someone who has a lot of research background, maybe PhD with a postdoc, and has worked on, a lot of kind of evidence analysis and dissemination as well. Is that something that you think they'd be looking for there?
There might be. I mean, I don't think you'd necessarily have to have a PhD per se, because you can get research experience in other ways. But certainly if you had a PhD and some postdoc experience, that would be ticking this box hard. Yeah.
But if you don't, it won't push you out.
Yeah.
Okay.
I agree.
So what do you think the other experience you would need to have to kind of fulfill those specific duties if you didn't have a PhD and postdoc background?
So for example, when I finished my MPH at LSHDM, I stayed on at the London School for a couple of years working as a research fellow.
Mm-hmm.
At the time I was toying with the idea of doing a PhD, but I didn't. And so in that 2 years, I got quite a lot of experience in the space of designing research projects, collecting data, analyzing it. So So, and then after that, I worked at the World Cancer Research Fund, which was also kind of experience in the research space, again, without having necessarily done a PhD. Some people do a research master's degree. So you all maybe have just been involved with a research project in some sort of working environment that gave them exposure to that sort of thing. I mean, a PhD would be the sort of, that is the gold standard. If you've done a PhD, you've really, shown your mettle in the area of research. But, if you've done a PhD, you've spent a lot of time and trouble getting yourself set up for a career in academia, and you're probably not looking for this job, right? So if you, so you know what I mean? Like, I think they would accept somebody without a PhD that could demonstrate a research method experience.
Yeah, okay, perfect. And then the next one there, designs and executes different types of surveys, assessments, reviews. Sounds kind of similar to those sort of research skills again. Summarizes the global estimates on AMR burden of disease for the GLASS report. So reporting, again, research skills, similar stuff. So the GLASS would be the Global Antimicrobial Resistance Surveillance System. So again, probably some sort of exposure to the software that would have been, that would you'd need to have for that, for those duties. So a lot of research.
I would say that if you're applying for a job like this, things like the GLASS, you want to look that up, make sure that you know and understand what it is, especially when you're preparing for the interview. If I go back to the beginning of the job right here, right, we said that the objectives of this program to mitigate drug-resistant infections, based on, number one, the Global Action Plan on Antimicrobial Resistance. So when you're preparing for your interview, you find that document and read it carefully. Number two, the 13th Global Program of Work for the WHO. Find it, print it out, read it. This is, the preparation for your interview. You need to be very comfortable with these documents because these are the things that are driving the work that's been done in this program. And then, of course, the Sustainable Development Goals. Let's end. I realize we've been talking for about an hour now, and what I want to do perhaps is just as a last point of discussion is talk about preparing. Let's assume you've applied and you offered an interview. Jaleese, they say this is a competency-based interview. What do they mean by that? What do they mean by competency-based interview? How would you prepare for a competency-based interview?
Well, first of all, you'll have also passed the written test. There's a good chance you'll get a written test before you get here. So you've passed your written test and you're coming up to competencies. Can we see the competencies again that they have here? Go down.
So they've just got qualifications.
No, there's a list somewhere. No, keep going. It was there. WHO competencies. Here they are. This is it. So these are super important when preparing your interview. You know what the job is about, but those competencies, because the questions in WHO interviews are competency-based questions. And so if what they will do is they'll want you to demonstrate those 5 competencies within a certain questions, and those questions will be geared to that. Teamwork. Explain to me when in a setting that you had where you had to work in a team and deliver results, what were the challenges and how did you overcome them as a team? I mean, this is an invented off the head one. You can, before an interview, prepare those competencies with that kind of logic in mind. I worked on this project in a team, we were 5, we did this. And so they will want you to literally outline what the situation was, what happened, what was the outcome, and what did you take away? And you demonstrate that. And that will be the same throughout that, or when you this is a biostatistician. Okay, you've done a massive report and there's loads and loads of data in it, and you had to communicate it to a big audience. How did you go about getting that report ready and communicating it? And you then have to go off and say, I did this and the other and that. And you will have a panel of 4 people in front of you. Hiring manager will be there. HR will be there. There'll be somebody from staff association, possibly another. It could be 3 to 4. I can't remember the other one who's there. And they will take it in turns each to listen. And so staff association is representing, people in general. The hiring manager will have his interests. And so they will each ask these different questions, and they might get into they will get into the technicalities, but you've passed your written test, so they kind of know that you're good. Now they're looking for these skills. And I think a lot of people don't realize that it is such a different interview from any other organization, or like private sector or NGO, where they want to know who you are and stuff. This is not an easy one to get through, and so the more prepared you can have, or the more thoughts you can have on what they are, those types of questions, the better it is for you.
I would say this: when I prepare for a job interview, firstly, I carve out time to do it. And it's not just a preparation for a job interview isn't something that is a rush job. You don't just quickly prepare the day before. I start preparing for a job interview well in advance. I list out what I think might be questions that they might ask. And against each of the questions, as Jaleesa has alluded to, I make sure that I can point to examples of where I demonstrated that particular skill or competency. I might add in that, if you're talking about a particular thing that you did, you might want to add how it is that there were challenges that you needed to overcome, what you did. And you need to be talking about what you did, not what you know. So they don't want to hear you waxing lyrical about your technical knowledge in a subject. They want to hear about what you did, and you want to highlight, that you were able to overcome problems or adversities or challenges, and this is what you did, and these were the outcomes of the work that you did, the actions that you took. And you certainly want to spend time preparing for these interviews. You didn't get a friend to ask you the questions, practice answering the questions, and make sure that you're nice and comfortable with answering those questions. And then even if the questions that you've prepared for don't come up, the fact that you're going into the interview feeling comfortable with a certain quota of questions will make you a lot more confident and able to address questions.
And if they put that you want you to speak French, you're likely to get a question in French.
That's true. Okay. Then people often want to know about remuneration. So at this job, if we go down here, this is the remuneration associated with this particular package. This is a P4 position. So just to let you know what the hierarchy looks like, it goes P1, 2, 3, 4, 5, 6. Jaleesa, am I right that there's still D, 1, 2, and 3? So that's director level 1, 2, 3. Then there's ADGs, which I think have got a different name now, and then there's the DG.
Director General himself.
Sorry?
The Director General himself.
Yeah. So a P4 position in that hierarchy is still kind of relatively low down the totem pole. And given that this is a job that just requires 7 years of experience, and a master's degree, this isn't a particularly senior job. And yet they're still offering, I think, a very handsome remuneration package. So they really are trying to get high quality people. Now, these salaries are not set by the WHO. They're set by the UN system. Jaleesa, am I right about that? This isn't the WHO policy. So if people have criticisms about the pay levels of the WHO, it's not the WHO's fault. The WHO lives within a particular environment, and these things are prescribed to them. And again, it's not the people that work at the WHO's fault. So, if anybody kind of, has any concerns, just keep that in mind. But here we've got a base salary of $73,516. Then this is a living allowance, or this increase that is associated with the cost of living in Geneva, which is $5,759 a month, which translates into another $69.36 per annum. And then, now they didn't say it in this particular job, but I'm pretty sure that it's the case because it was when I worked at the WHO, that for short-term contracts, when you move to Geneva, you get a relocation allowance of 10 grand. And when you leave Geneva, you get a relocation allowance of 10 grand again. And so in a 1-year contract, that would translate into an extra 20 grand for the year in terms of locating and relocating in and out of Geneva. When I worked at Geneva, that was the case. It's not stated in this particular thing, but it wasn't in my terms of reference either. So I'm assuming that that's the case. There are other perks. There's 30 days of leave. That's 6 weeks of leave during the year. There's allowances for dependencies, I think that is if you've got a family member that is unwell and you have to look after them. I don't really know a lot about that. Jaleese, you might know more about that.
Yes, exactly. If you've got somebody who depends on you, you might get an allocation, it's like child allocation.
Okay, yeah. And then there's the education grants. And again, when I worked at the WHO, I didn't have kids, but the education grants is to help to pay for education. Jaleese, you might know more about that.
So a lot of people, if you're coming from an Anglophone country, just putting your children into a Swiss school might prove challenging for the children. So they will help towards putting your children into an international school. I say help because it doesn't cover the cost of those international schools. They are very, very expensive. And so they will only go up to like 75%, and you have to find and they're capped. So even then, those schools are expensive. And I have the impression that all my working life has been to pay for school fees at the moment. So beware of those schools. But yes, obviously, it's super helpful. And if you have children with learning difficulties but don't speak French, I mean, you can't put them into a Swiss system. You do need to keep to an English, and there are schools available, and it's for that. Okay,
so there's education grant. The other thing to keep in mind is that you don't pay tax because you're working within the UN system. So this money is net. It's money that lands in your bank account, which is really nice. The one exception to that is if you're an American citizen, the US government will still tax you even if you're working abroad. And I understand that the WHO then compensate you for that. So they actually give you some additional money to compensate you for the fact that you have to pay tax in the US. But any other country, any other citizens are not required to pay tax if they're working within the UN system. So this is net. So it's actually, if you keep that in mind, it turns into what I consider to be an extremely healthy pay package. And then there's a pension and health insurance stapled onto that, which is also lovely. Okay, so we've covered a lot. We've been talking for quite a long time, so I think we probably want to kind of like wind things down now. But a huge thank you to everyone for coming on, to Ellen and Kale. I know you had technical problems getting in and you had to do some work before you got in, but thanks for popping in. Always good to see you.
Next time.
Lise,
you too.
Always a pleasure. And we need to catch up. It's been way too long. Any burning questions that we need to address that have popped up that we can just, in the last few seconds, if there's anything that we can just quickly address that might have been asked?
There was one question there. How long would you expect this whole application process to take?
Long time. I think you're right in saying that. It can be very lengthy. Unfortunately, they're not known. No UN agency is known for their speediness. It takes a while. The candidates come in, there's a screening, then it goes to different groups, and then they have to convene panels. And it's not unheard of that people get jobs like a year later and they've completely forgotten they've even applied for things.
Wow.
Yeah. Oh, yeah. No,
and it can go quickly too, but don't be surprised. It
can take a long time, definitely. Okay. Well, thanks everybody for watching. If you're interested in jobs in the global health space, then go to my YouTube channel, click on the join button, become a member. We've got specific content and advice about jobs in global health. In actual fact, what I'm going to do when the next job I apply for, I'm going to record my entire process applying for that job so that you can see how it is that I go about applying for a job. But I'm going to stick that just in the member section. The videos that I stick in the member section are far less polished than my videos. There's no bump, music, flashing lights, nothing like that. They're much less flashily produced. They're more about the content for people that are really interested in working in global health. Okay.
No, you just looking at the question there. No, your country doesn't have to approve anyone anywhere in the world. Once you become staff at WHO, you go under the UN banner, and you will actually get a little blue passport that makes you working for the World Health Organization and the UN. No, I'm just looking at the questions quickly.
No, that's fine. That's a good question, actually. So you can travel around with a UN passport, which is really nice.
When you're on duty travel, not for your personal pleasure.
I admit to nothing. Okay, well, look, thanks, everybody. Don't do drugs. Always do your best. Don't ever change. See you here again sometime soon. Until then.